is Noe from Gugulethu. I'm a Health Forum member. I think we started the Health Forum at Gugulethu. The time that we attended meeting is in Klipfontein. Klipfontein is a sub-district on its own that was formed then by facility managers at each clinic and members of the health committee. Then each of every month, second Saturday of every month, we attended the meeting at Klipfontein in Silvertown, where we were giving reports about the clinic, complaints and compliments. Then in that clinic, the health department staff, the facility managers will also attend the meeting. So we find it very difficult as a health committee. We find it very difficult as a health committee to discuss other matters because the officials are in the meeting, the staff managers. So we said, after we have this meeting, let us have our own meeting outside the clinic so that whatever we have challenge about, we strategize and then we go to the clinic knowing that if the agenda is stock out, we know how to address those stock out problems. So we decided to form Health Forum outside the clinic because it was not only health committee that has problems about the health department, it was other organizations also in Gugulethu that are health related that also had a problem with the Department of Health. When I'm talking about the problem then, it was people queuing outside the clinic, people were turned back because they were taking a number of people for a day. Then people were sick lying outside the clinic, and there was also a crime that was taking place outside the clinic. Meanwhile, people are queuing. So we said, no, man, let us involve other community members, other leaders, so that we form this structure, so that we don't, if there is an organization that is also doing a health-related issues, you don't do it in your own corner. Let us come together and fight all those challenges as one body. So we form the Health Forum.
I am a disability rights activist in Gugulethu. So we found it that it is quite important for us as the disability community to get our involvement in the Health Forum because as people living with disabilities, we do have challenges in regard to health issues.
Yeah, thank you very much to give me this opportunity to say about the Health Forum. Health Forum was there before, and when I came on board, the Health Forum already was there. I was in an organization called Eviction Campaign. That was my organization. And people came to the meeting crying that when they attend the clinic, they were chased away, or maybe they will be insulted by the nurses. So they came to us and lay a complaint. And we decided in our meeting that we are going to elect people that is going to the clinic and go and ask for a meeting. I was one of those people who was elected.
Thank you very much to having this opportunity about interviewing Noluthando Mazwi, who she is a community activist of Gugulethu. She was also involved in an organization called Hizani Sake Organization. which is now based at NY 3. Before it was based at NY 1 clinic. It's whereby the collaboration of different stakeholders, my engagement as a health forum that time, because my passion is to educate people who was defaulting at our clinic. The challenge that time was the TB and HIV and AIDS. That's why I was so passionate then to be part of the health forum. Through that basic education did I have from the NGO. That NGO was focused in the education of the side effects of the tablets which they taking that time. They couldn't understand why did they must eat medication. And as a Zanusaka at that time, we have soup kitchens whereby to motivate the people, they must use their medication. We support them, so then the patient won't say to us, she can't take the medication just because she got nothing to eat. It's whereby now the NGO called Zanusaka partnership with the Health Forum. That's why now I'm a supportive Health Forum of Gugulethu.
The reason for us to be presented in the health committee, we wanted our voice to be heard, you know. As I said earlier on, that nothing about us without us. If there is no voice of a person with a disability inside the committee, then it will mean that, you know, all our issues will be ignored, will never be addressed.
If you want to set up a health forum, you really need to know what are you doing, what you want to achieve out of that. But if you want to set up a health forum because you are unemployed, you want it might be a ladder for you to get there, you mustn't have vested interest. You must have interest of serving your community. That's all I can say. You must apply to the constitution that you have drawn as a health forum. You must stick to the aims and the objectives of the health forum. If we are talking about social determinants of health, you must measure from the time that you started the health forum, what are the achievements? What are your downfall? Where you can correct? Because it's not every time that things will go smooth. You have to go back to the drawing board if see that things are not going straight, and go to the drawing board and try to correct those things. There are going to be fights amongst health forum members, but you must fight in terms of coming to the sense of why are we fighting for? Can we correct this? Can we sit down and correct these things? Because we are not here for our own agendas. We are there to serve the community. If you are a health committee member, you represent an organization, you must go back to your organization and go report. Luckily for us as a health forum members, we all coming from different backgrounds of coming from our own organization. I'm coming from a civic structure that is looking at the bread and butter issues. So when there's a civic organization, I must ask a slot. If there's nothing on the table that talk about health, they know very well that I will lift up my hand and say, if I don't have a slot, there is an announcement. From that announcement, it's where people will start to ask questions about health issues. And others are belonging to other wards. I can phrase the last meeting that Usis Noltando and Mama Sizana were having at Kwezi, when I've sent them and said the community of Ward 41 want to ask questions about the clinic. So I sent the two because they belong to this area. So they were the ones in the public meeting of councillor that were giving reports and were answering questions concerning health issues that were asked by community. And the last meeting that we have that was organized by us, it was here in this room, where we also were giving the status of where we are in COVID-19, what are the challenges, in the clinic, how far are we in terms of vaccination, and what are the also challenges where people were raising their concerns and the other family member were raising a concern of their medical history challenge that they have.